Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. It is 9:15. We're into the second hour of our show this morning. A very warm welcome to our Polokwane listeners on One Nation FM. Just to let you know what we will be covering in the second hour, we'll be talking with my colleague here at Salam Media, and that is Inayat Wadi. We are going to be looking at the Jamiat celebrating 100 years of service in South Africa. Alhamdulillah, may they serve us for many, many more years to come. Also on the show, we're going to be talking about the Global Halal Summit 2023 happening in Malaysia. But right now, we are going to be talking with Dr. Akhtar Hussain from the South African Medical Association. And this is in light of, an unbelievable story. Especially since when one goes to state hospitals or clinics, etc., they just don't seem to have enough doctors to service the people concerned. And here we have a situation where a group of unemployed doctors who trained abroad marched to the union buildings in Pretoria on Wednesday past to complain that they are yet to practice despite completing their training. They were clad in scrubs, and the group, made up of up to 250 junior doctors, said that they were still waiting on the dates from the HPCSA to write the board exams that would enable them to start practicing. Guys, this is just not on. Given what's happening in our state hospitals and state medical services, why on earth is this matter dragging on forever and a day? Dr. Akhtar Hussain, Assalamu alaikum to you. Welcome to the program. And are you equally frustrated with the situation?
Walaikum salam, Julie. Thank you so much having me on Salam Media. Yes, you are perfectly correct putting your question. Let me tell you, this is not started yesterday. This is more than 10, 15 years crisis going on.
Mm-hmm.
On behalf of South African Medical Association, we have been raising this type of crisis, shortage of doctors, shortage of specialists, shortage of intern training, poor condition of the health system, broken health system. This Russian qualified and Ukraine qualified or any other international qualified South African citizen who is studied in overseas, they come back here, they have to go through a struggle. Many years they have to wait to write the board exam. And especially this march related on the few days ago by those doctors who went to Russia 2016 and Ukraine, and they've been sent by Department of Pumalanga and the Free State. And not only that, there are people going to Turkey and many other countries from the department, from the government of South Africa, and fully sponsored, paid college fees, accommodation. When they come back, they're left alone. They are in a cold phase. They have to go through the HPCSA registration, and HPCSA haven't got enough capacity to run those foreign qualified doctors exam, because sometime there were 700 before. It was coming from Dominican Republic, even including Cuban doctor government to government program. They have to go integration and they have to study another 2 years to a medical school. So this marching, because they are sitting more than 2 years at home, there are no board exam to enter for a registered doctor in South Africa. So what happened? There are no sign that certain month you can write the exam. And before doing that, they have to go through a process, which is all those foreign qualified documents must go through the ECFMG, that is in USA verification. That's a education department, one of the NGO in the USA. They charge each document $100 from the student to verify your degree. After that, they submit to HPCSA. Then HPCSA wait for the board exam date. They only do 50 or 100 at a time. It's happening once a year. Last 1 year, they don't have any exam. So the backlog is piling up, and the students are without job, without work. They can't do anything medical related.
I think the situation is absolutely unacceptable given what's happening in our state hospitals and the fact that these youngsters have now completed their studies, as you say, sitting at home doing absolutely nothing. And we need medical doctors. We need them in our state hospitals and wherever they can serve us, we need them to start serving us. And obviously, we do understand these are junior doctors. So the 3, 4 years that they've wasted sitting at home, they could have started even possibly specialized in a certain field. What I'm not understanding is this is taxpayers' money that has been used. We've sent scores of young people abroad to study. It doesn't matter where they have studied. The HPCSA has to get off their hands, and they need to make this happen. They need to try and sit 2 or 3 exams during the year and get these people employed in state hospitals wherever they can be utilized, and let's take off the burden on the hospitals and the other staff. I don't think this is a very big ask from us as citizens. What do you believe needs to happen, Dr. Hussain?
No, you are right. It's not a big ask at all. Let me add some more. It's not only the taxpayer money, it's the parents' pension money. Those parents are retired. They have been paying those fees for those students, like HPCSA exam costing 15,000 Rand exam fee. That
Sure.
I mentioned $100. If there's a 10 document to verify from ECFMG from USA, that will cost another 18 to 20,000. Plus, they need to live every day to day work. They have to continue study for the exam. So cost is just too much for students who haven't got job. Even when they met to the Pumalanga Department of Education or Department of Health or Premier, whoever was representing government, they say if you don't have a job, go and work in a ShopRite and Checker or sell potato and tomato. So that's how the reaction by the government. So there's no respect for the profession. And we, as a South African Medical Association, from the beginning, we have been supporting, we have been guiding them, we have been advocating them. We asked for meeting for National Department of Health, we asked meeting for Health Professional Council, but there are no response. And
So we hear that, yes, carry on.
now they say they will have an exam, but they're not sure when, this month, next year, or they don't have an exam because I mentioned there are no capacity. Health Professional Council to run this exam. They go to the medical school. Then 10 medical school, the HPCSA issue a tender to run this exam. Only one medical school responds. 9 of them rejected. In fact, they are not interested. So only University of KwaZulu Natal has given the bid on the tender, and there's a memorandum of understanding or MOI supposed to be signing, and there was a delay, and they are accepting that there is a delay, but they verbally they mention that they will run few exams, but I don't know when and how they will run those exams.
Dr. Hussain, we're not talking rocket science here. We're not asking someone to build us a spaceship or something outlandish like that. All we're asking is set a plan in motion. It's not that difficult. If you can't do it, then get in a logistical specialist and see how you can accommodate these students to write the exam and become gainfully employed, and possibly also assist in the backlog at our state hospitals, because that's where they will start. Obviously, once they qualify, once they pass the exams, they can be gainfully employed at state institutions. We've heard the National Health Department spokesperson, that's Foster Mohali, has said that the department would see how it could assist these doctors. Do you think that this comes on the back of the march that the doctors undertook last Wednesday? And how much more pressure do you believe we need to put on the departments concerned to get some action? And who do you suggest supports these unemployed doctors? What do you think needs to happen now for us to get this thing, for it to gain momentum and get these people sorted out?
Well, the memorandum is submitted to the presidency, to the Health Professional Council, the National Department of Health. I think it's President Cyril Ramaphosa need to act, intervene urgently, give a direction, because that 1 week already passed. I haven't heard anything way forward, what they're going to do and how they're going to go and do those exams, because Department of Health, after exam, they need to create a job, they need to create internship, and that internship already we are looking at funding. Previously, always shortage of funding, there no money. Treasury is already cutting budget. So health budget is already cut. There are very minimum level of employment. I don't see much advertising post for doctors. If there's a 20 doctors in one hospital, now you will find only 6 or 7 working, because cost saving. They are saving money in versus patient's life.
Sure.
So service delivery, quality service delivery is non-existing at the moment. It's not only that, the backlog of chronic cases, backlog of operation, orthopedic piling up. Apart from that, they budget for South African interns. Those are 2,700 for 2023 or 2024. This new another 200-300 internship posts going to be created. Are their treasury ready? Are their fundings are available? Are the government ready? I don't think there will be any funding, because the last week I read that the treasury is already cutting the fund and the health system will be affected badly.
And this is the same ministers and people in top echelons of government talking about introducing the NHI. How on earth is it ever going to work in this country when they can't even accommodate these students, foreign trained students, to write the necessary exams and to absorb them into obviously the medical state hospitals or wherever they are sorely needed? A really sad state of affairs. I'm wondering, Dr. Hussain, can the not the HPCSA, they can't seem to get anything right. But what about, I guess, the Department of Health or the bodies that you serve on? Can you guys not get a member of Parliament to take this matter to Parliament to get it speedily passed through and resolved? Because that seems to be the
Definitely,
only.
yes, definitely we will advocacy will be done for the foreign qualified doctor, because we are waiting for the response of those memorandum was given. By next week there must be solution, must be answer. After that we may take it to the legal way and the parliamentary portfolio committee.
Good on you guys. We will be following the story very closely and talk with you again in a couple of weeks' time to get an update. Keep up that
Thank
good
you
fight,
so much.
inshallah.
Thank you so much for having me. Alaikum salam.
That was Dr. Akhtar Hussain talking about that ridiculous situation. Can you believe it? We have such a shortage of doctors in the country, and there are hundreds of doctors that haven't written the exam yet, foreign trained doctors. They are sorely needed in the system, and government, as usual, is sitting on their hands. It's 9:29. This is News and Views on Salam Media. Standing by to talk with us in a minute or two. We are going to be talking to Maulana Zakaria Philander, COO at Muslim Judicial Council, Halal Trust, and he's going to talk to us live from Malaysia regarding the Global Halal Summit 2023. And thereafter, my colleague Inayat Wadi will be joining us to talk about the Jamiatul Ulama South Africa celebrating 100 years of service in South Africa, and may they continue for 100 and more years going forward, inshallah.